Which of the following is the first line treatment in a child with absence seizures? A. Phenytoin, B. Valproic acid, C. Ethosuximide, D. Carbamazepine. Correct answer C. Ethosuximide. Absence seizures are brief episodes of staring and unresponsiveness. Ethosuximide is the drug of choice for typical absence seizures. It is well tolerated and effective in most cases. A child with a history of recurrent fractures, blue sclera and hearing loss likely has A. Rickets, B. Osteogenesis imperfecta, C. Hypophosphatemia, D. Scurvy. Correct answer B. Osteogenesis imperfecta. Osteogenesis imperfecta is a genetic disorder affecting collagen. This condition causes brittle bones, blue-tinted sclera, and sometimes hearing problems. The condition varies in severity and requires supportive care. Which of the following is a major Jones criterion for diagnosing rheumatic fever? A. Arthralgia, B. Fever, C. Erythema marginatum, D. Elevated ESR. Correct answer C. Erythema marginatum. The Jones criteria help in diagnosing rheumatic fever. Erythema marginatum, a non-itchy rash with a wavy border, is a major criterion. Arthralgia, fever and elevated ESR comes under minor Jones criteria. A child presents with repeated infections, low IgG levels and absent tonsils. What is the likely diagnosis? A. Common variable immunodeficiency, B. Bruton's gamma-globulinemia, C. Selective IgA deficiency, D. SCID. Correct answer B. Bruton's gamma-globulinemia. Bruton's gamma-globulinemia is an X-linked disorder affecting boys. Due to absence of mature B cells, they have low immunoglobulin levels and no visible tonsils or lymph nodes. Infections begin after maternal antibodies wear off. A child with precocious puberty, cafe au lait spots and fibrous dysplasia likely has A. McCune-Albright syndrome, B. Turner syndrome, C. Klinefelter syndrome, D. Noonan syndrome. Correct answer A. McCune-Albright syndrome. McCune-Albright syndrome is characterized by the triad of cafe au lait spots, early puberty and bone lesions. This syndrome is due to GNAS gene mutation. A neonate with delayed umbilical cord separation and recurrent skin infections may have A. Leukocyte adhesion deficiency, B. Chronic granulomatous disease, C. SCID, D. Chediak-Higashi syndrome. Correct answer A. Leukocyte adhesion deficiency. Leukocyte adhesion deficiency. LAD is a rare immune system disorder where WBCs can't stick to blood vessel walls to fight infections. Normally, WBCs roll, stick and squeeze out of vessels to attack germs. In LAD, they lack glue proteins, like integrins needed for this process. As a result, infections of skin, gums, lungs keep coming back, heal slowly and don't show pus. Babies with LAD often have delayed umbilical cord falling off. It's caused by genetic mutations and diagnosed with blood tests, that is low CD18 and CD11 proteins. Treatment includes antibiotics, stem cell transplants or gene therapy. Early action saves lives. Classic feature of Kawasaki disease includes all except A. Strawberry tongue, B. Conjunctivitis, C. Desquamating rash, D. Vesicular rash. Correct answer D. Vesicular rash. Kawasaki disease presents with fever, rash, conjunctivitis and red tongue. Vesicles are not a feature. Risk of coronary artery aneurysm is serious. A child with albinism, recurrent infections and giant granules in neutrophils likely has A. Chediak Higashi syndrome, B. Grease-Kelly syndrome, C. Hermansky-Pudlik syndrome, D. SCID. Correct answer A. Chediak Higashi syndrome. A child with albinism, recurrent infections and giant granules in neutrophils likely has Chediak Higashi syndrome. This rare genetic disorder disrupts how cells package and transport materials, causing partial albinism, light skin, hair, frequent infections and abnormal granules in white blood cells. The giant granules in neutrophils impair their ability to fight bacteria, leading to recurring illnesses. Early treatment is important. A stem cell transplant can help before the disease worsens. Without treatment, it can progress to a dangerous phase with high fever and organ damage. What is the classic rash distribution in measles? A. Starts on limbs and moves to trunk. B. Starts on face and spreads down. C. Starts on trunk and moves to face. D. Only on extremities. Correct answer B. Starts on face and spreads down. The measles rash usually begins behind the ears and along the hairline before spreading downward. The rash is caused by the immune system attacking virus-infected cells in the skin. The downward spread of the rash follows the pattern of the virus moving through the bloodstream. The face develops the rash first because it has rich blood supply of blood vessels. Which condition presents with painless rectal bleeding in a child and is due to ectopic gastric mucosa? A. Hirschsprung disease, B. Meckel's diverticulum, C. Intussusception, D. Ulcerative colitis. Correct answer B. Meckel's diverticulum. Meckel's diverticulum is a small pouch in the small intestine that some babies are born with. It is a leftover part from the baby's development in the womb. Sometimes this pouch has stomach-like cells that make acid which can cause sores and bleeding in the intestine. It usually shows up as painless blood in the stool and surgery may be needed if it causes problems. A newborn with a scaphoid abdomen and respiratory distress most likely has A. Diaphragmatic hernia, B. Tracheoesophageal fistula, C. choanal atresia, D. Pneumothorax. Correct answer A. Diaphragmatic hernia. Congenital diaphragmatic hernia allows abdominal contents into the chest. This compresses the lungs and causes respiratory distress. The abdomen appears scaphoid or sunken. A child with eczema, thrombocytopenia and recurrent infections likely has A. SCID, B. Wiskott-Aldrich syndrome, C. Ataxia telangiectasia, D. Chediak Higashi syndrome. Correct answer B. Wiskott-Aldrich syndrome. VAS syndrome is a rare X-linked genetic disorder characterized by a triad of symptoms: eczema, thrombocytopenia, and recurrent infections. It is caused by a mutation in the VASP gene which plays a crucial role in immune cell function. Which heart defect shows egg on a string appearance on chest X-ray? A. Tetralogy of Fallot. B. Truncus arteriosus. C. Transposition of great arteries. D. Coarctation of aorta. Correct answer C. Transposition of great arteries. Transposition of the great arteries creates an egg on a string look on X-rays. The egg is from the misaligned aorta and pulmonary artery. The string is the narrow mediastinum from thymus shrinkage. This happens because the aorta connects to the right ventricle wrongly. Babies with transposition of the great arteries turn blue at birth and need immediate care. A child with chronic cough, foul-smelling stools, and failure to thrive likely has A. Asthma, B. Cystic fibrosis, C. Tuberculosis, D. GERD. Correct answer B. Cystic fibrosis. This triad of symptoms, that is cough, foul stools, poor growth, is classic for cystic fibrosis. Newborn screening now detects most cases early. The chronic cough suggests recurrent lung infections due to thick mucus buildup. Foul-smelling stools, that is steatorrhea, occur because pancreatic enzymes can't reach the gut to digest fats. Failure to thrive results from both poor nutrient absorption and increased calorie needs from lung disease. A sweat chloride test, that is more than 60 millimoles per liter, confirms cystic fibrosis. Early diagnosis and treatment with enzyme supplements and airway clearance improve outcomes. Classic feature of mumps infection in children is A. Coryza and cough, B. Parotid gland swelling, C. Maculopapular rash, D. Gastroenteritis. Correct answer B. Parotid gland swelling. Mumps infection is most recognized by painful swelling of the parotid glands, that is parotitis. This swelling gives a chipmunk cheek appearance. This typically occurs 16 to 18 days after exposure and lasts 7 to 10 days. About 30% of cases may have no swelling. Complications can include orchitis in postpubertal males or aseptic meningitis. The MMR vaccine has dramatically reduced mumps cases. A child with barking cough, inspiratory stridor, and steeple sign on X-ray most likely has A. Epiglottitis, B. Foreign body aspiration, C. Croup, D. Bronchiolitis. Correct answer C. Croup. Croup or laryngotracheobronchitis is viral in origin. Croup causes a characteristic barking cough and stridor. The steeple sign is seen due to subglottic narrowing. Which congenital infection classically presents with periventricular calcifications and sensorineural hearing loss? A. Toxoplasmosis, B. CMV, C. Rubella, D. HSV. Correct answer B. CMV. CMV stands for cytomegalovirus. Congenital CMV infection is the most common viral cause of birth defects. CMV classically causes periventricular calcifications visible on brain imaging, along with sensorineural hearing loss. Other features include microcephaly, hepatosplenomegaly, and petechiae. A child with pica, spoon-shaped nails, and pallor is most likely suffering from A. Thalassemia, B. Iron deficiency anemia, C. Lead poisoning, D. Vitamin B12 deficiency. Correct answer B. Iron deficiency anemia. The classic triad pica, koilonychia, and pallor strongly suggests iron deficiency anemia. Pica, that is craving to eat non-food items like ice or dirt, develops due to iron depletion. Koilonychia, that is spoon-shaped nails, occur from nail bed changes in chronic deficiency. Pallor reflects low hemoglobin levels. Iron deficiency is confirmed by low serum ferritin, microcytic anemia on CBC, and response to iron supplementation. A neonate with micrognathia, cleft palate, and airway obstruction likely has A. Down syndrome, B. Pierre-Robin sequence, C. Treacher-Collins syndrome, D. Edwards syndrome. Correct answer B. Pierre-Robin sequence. Pierre-Robin sequence is also known as Pierre-Robin syndrome, PRS. It is a rare congenital birth defect characterized by an underdeveloped lower jaw, that is micrognathia, a backward displaced tongue, that is glossoptosis, and often a cleft palate. These features can cause breathing and feeding difficulties in newborns. Which of the following is a sign of increased intracranial pressure in infants? A. Sunken fontanelle, B. Hyperactivity, C. Bulging fontanelle, D. Bradycardia with warm extremities. Correct answer C. Bulging fontanelle. A bulging fontanelle can indicate increased intracranial pressure in infants. Other signs may include vomiting, irritability, and altered consciousness. Imaging is often required to identify the cause. Which of the following is seen in Kwashiorkor but not in marasmus? A. Edema, B. Wasting, C. Poor appetite, D. Growth retardation. Correct answer A. Edema. Kwashiorkor is characterized by protein deficiency leading to edema, fatty liver, and skin changes. Marasmus involves overall calorie deficiency without edema. Edema is the key difference between the two. Which heart defect is most commonly associated with Down syndrome? A. Ventricular septal defect, B. Tetralogy of Fallot, C. Atrioventricular septal defect, D. Patent ductus arteriosus. Correct answer C. Atrioventricular septal defect. Children with Down syndrome often have atrioventricular septal defects. It involves both atrial and ventricular septa as well as valves. Early surgical correction is needed to prevent heart failure. Echocardiography confirms diagnosis. Which childhood tumor often crosses the midline of the abdomen? A. Wilms tumor, B. Neuroblastoma, C. Hepatoblastoma, D. Lymphoma. Correct answer B. Neuroblastoma. Neuroblastoma often arises from adrenal glands and crosses the midline. It can present with abdominal mass, bone pain, or periorbital ecchymosis. Urine VMA levels help in diagnosis. What is the recommended daily dose of vitamin D in infants? A. 200 international units. B. 400 international units. C. 600 international units. D. 1000 international units. Correct answer B. 400 international units. Infants should receive 400 international units of vitamin D daily starting from the first few days after birth. This helps prevent rickets and support bone growth. Which enzyme is deficient in phenylketonuria? A. Galactose 1-phosphate uridyl transferase. B. Phenylalanine hydroxylase. C. Tyrosinase. D. Hexosaminidase A. Correct answer B. Phenylalanine hydroxylase. Phenylketonuria is due to deficiency of phenylalanine hydroxylase. This leads to accumulation of phenylalanine, causing intellectual disability if untreated. Early dietary management prevents complications. Which type of cerebral palsy is most common? A. Ethetoid. B. Ataxic. C. Spastic. D. Hypotonic. Correct answer C. Spastic. Spastic cerebral palsy is the most common type and results in stiff muscles and poor coordination. It may affect one or more limbs. Therapy and assistive devices help improve function. Which of the following is a common feature of Turner syndrome? A. Tall stature. B. Macrocephaly. C. Webbed neck. D. Gynecomastia. Correct answer C. Webbed neck. Turner syndrome is a chromosomal disorder seen in females with 45X karyotype. Features include short stature, webbed neck, and delayed puberty. Cardiac anomalies like coarctation of aorta may be present. In a child with congenital rubella, which triad is typical? A. Deafness, cataract, cardiac defect. B. Deafness, hepatosplenomegaly, rash. C. Cataract, hydrocephalus, convulsions. D. Microcephaly, limb defects, cleft lip. Correct answer A. Deafness, cataract, cardiac defect. Congenital rubella classically presents with sensorineural deafness, cataract, and congenital heart defects like PDA. It occurs when maternal infection happens in the first trimester. Prevention is through maternal vaccination. Which of the following conditions can lead to precocious puberty? A. Hypothyroidism. B. Hypopituitarism. C. Adrenal tumor. D. Growth hormone deficiency. Correct answer C. Adrenal tumor. Adrenal tumors can secrete sex hormones leading to early puberty. This is called peripheral or precocious puberty. Imaging is needed to confirm and treat the tumor. Which condition is commonly associated with absent radius and presence of thumb? A. Holt-Oram syndrome. B. Fanconi anemia. C. TAR syndrome. D. Vactral association. Correct answer C. TAR syndrome. TAR stands for thrombocytopenia absent radius syndrome. It is characterized by absent radius bone with a present thumb. It also involves low platelet counts leading to bleeding tendency. Delayed passage of meconium in a newborn raises suspicion of A. Duodenal atresia, B. Hirschsprung disease, C. Pyloric stenosis, D. Necrotizing enterocolitis. Correct answer B. Hirschsprung disease. Failure to pass meconium within 48 hours may suggest Hirschsprung disease. It's due to absence of ganglion cells in the bowel. Diagnosis is confirmed by rectal biopsy. Treatment is surgical removal of the affected segment. A child presents with hypoglycemia, hepatomegaly and doll-like face. The probable diagnosis is A. Galactosemia, B. Von Gerke disease, C. Wilson disease, D. Maple syrup urine disease. Correct answer B. Von Gerke disease. Von Gerke disease is a glycogen storage disorder causing severe fasting hypoglycemia. Other features include a protuberant abdomen, hepatomegaly, and round face. Management includes frequent feeding and cornstarch therapy. The first permanent tooth to erupt is usually the A. Central incisor, B. Lateral incisor, C. First molar, D. Canine. Correct answer C. First molar. The first permanent tooth to erupt is typically the first molar, around 6 years of age. These are often called the 6-year molars. Eruption of teeth can vary, but this is usually the first milestone in permanent dentition. Which immunoglobulin is predominant in breast milk? A. IgG, B. IgM, C. IgE, D. IgA. Correct answer D. IgA. IgA is the main immunoglobulin in breast milk. It provides mucosal protection to the infant, especially in the gut. This helps reduce infections in breastfed babies. Other immune factors like lactoferrin and lysozyme are also present. What is the target of WHO's baby-friendly hospital initiative? A. Promote bottle feeding, B. Increase cesarean sections, C. Encourage early breastfeeding, D. Reduce neonatal ICU admissions. Correct answer C. Encourage early breastfeeding. WHO stands for World Health Organization. The baby-friendly hospital initiative promotes breastfeeding within the first hour of life. It supports exclusive breastfeeding for the first 6 months. The goal is to improve newborn nutrition and immunity. Hospitals must meet specific criteria to earn this title. Which condition in pediatrics presents with hyperpigmented macules and axillary freckling? A. Tuberous sclerosis, B. Neurofibromatosis type 1, C. Sturge-Weber syndrome, D. Ataxia telangiectasia. Correct answer B. Neurofibromatosis type 1. Neurofibromatosis type 1 shows cafe au lait spots and axillary freckling as early signs. It may also involve neurofibromas and learning difficulties. It's a genetic condition with variable expression. Regular follow-up is needed for associated complications. What is the characteristic heart sound in tetralogy of Fallot? A. Wide split second heart sound. B. Continuous murmur. C. Ejection systolic murmur. D. Diastolic murmur at apex. Correct answer C. Ejection systolic murmur. Tetralogy of Fallot typically presents with an ejection systolic murmur due to right ventricular outflow obstruction. Cyanosis and TED spells are also seen. Diagnosis is confirmed by echocardiography. Surgery is the definitive treatment. Which of the following is a common cause of cyanosis in a newborn that improves with crying? A. Choanal atresia. B. Tetralogy of Fallot. C. Transposition of great arteries. D. Truncus arteriosus. Correct answer A. Choanal atresia. In choanal atresia, the nasal passage is blocked, causing cyanosis when the baby tries to breathe through the nose. Crying opens the mouth and improves breathing, reducing cyanosis. It's often diagnosed by inability to pass a catheter through the nose. Management is surgical correction. Which of the following is a feature of precocious puberty? A. Delayed bone age. B. Short stature. C. Early development of secondary sexual characteristics. D. Absent pubic hair. Correct answer C. Early development of secondary sexual characteristics. Precocious puberty is marked by early appearance of pubic hair, breast development, or testicular enlargement. It may be central or peripheral in cause. Bone age is usually advanced. Early diagnosis helps guide treatment and monitor growth. Which condition causes blueberry muffin rash in newborns? A. Congenital rubella. B. Erythema toxicum. C. Melia. D. Neonatal acne. Correct answer A. Congenital rubella. The blueberry muffin rash represents dermal erythropoiesis from intrauterine infection. Rubella, CMV, or parvovirus B19 can cause this finding. Lesions are non-blanching blue-red papules. Associated features include hepatosplenomegaly and thrombocytopenia. Diagnosis requires viral PCR and serological testing. What is the most common cause of heart failure in infants? A. Congenital heart defects. B. Myocarditis. C. Arrhythmias. D. Cardiomyopathy. Correct answer A. Congenital heart defects. Congenital heart defects like VSDs cause 80% of infant heart failure. Left to right shunts increase pulmonary blood flow. Symptoms include poor feeding, tachypnea, and failure to thrive. Medical management controls symptoms until surgical correction. Early detection improves outcomes. What is the most common cause of neonatal seizures? A. Hypoxic ischemic encephalopathy. B. Intracranial hemorrhage. C. Hypoglycemia. D. Infections. Correct answer A. Hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy is the most common cause of seizures in neonates. It occurs due to reduced oxygen or blood flow to the brain, usually around the time of birth. This condition can lead to brain injury, which makes the newborn more likely to have seizures. Other causes like hypoglycemia or infections are also important but less common in hypoxic ischemic encephalopathy. Early recognition and treatment are crucial to prevent long-term complications. What is the most common cause of abdominal mass in a neonate? A. Neuroblastoma. B. Hydronephrosis. C. Wilms tumor. D. Multicystic dysplastic kidney. Correct answer B. Hydronephrosis. Hydronephrosis is the most common cause of an abdominal mass in neonates. It usually results from urinary tract obstruction, which leads to swelling of the kidneys. Many cases are detected during prenatal ultrasounds. Early diagnosis helps guide monitoring or treatment depending on severity. Most mild cases resolve on their own. What is the most common cause of death in children aged 1 to 4 years? A. Malnutrition. B. Congenital anomalies. C. Accidents. D. Infections. Correct answer C. Accidents. Accidents, especially unintentional injuries, are the most common cause of death in children aged 1 to 4 years. These include drowning, falls, and burns. Children in this age group are curious and mobile but lack danger awareness. Supervision and safety measures can prevent many of these deaths. Education of caregivers is key. What is the most common cause of delayed puberty in boys? A. Klinefelter syndrome. B. Constitutional delay. C. Hypopituitarism. D. Chronic illness. Correct answer B. Constitutional delay. Constitutional delay is the most common cause of delayed puberty in boys. These boys are usually healthy but develop puberty late than their friends. It often runs in families. Bone age is delayed but eventual adult height is normal. No treatment is needed unless there is emotional distress. What is the most common cause of obstructive uropathy in male infants? A. Vesicoureteral reflux. B. Ureterocele. C. Posterior urethral valves. D. Pelviureteric junction obstruction. Correct answer C. Posterior urethral valves. Posterior urethral valves are the most common cause of obstructive uropathy in male infants. They are extra flaps of tissue in the urethra that block urine flow. This can lead to a swollen bladder and kidney damage. It is usually diagnosed with prenatal or postnatal ultrasound. Early surgery improves outcomes. What is the most common cause of congenital infection worldwide? A. Rubella. B. Toxoplasmosis. C. Cytomegalovirus. D. Syphilis. Correct answer C. Cytomegalovirus. CMV is the most common congenital infection globally. Most babies have no symptoms at birth, but some may develop hearing loss or developmental delays later. It spreads from mother to baby during pregnancy. Early diagnosis and monitoring help manage complications. What is the most likely cause of a machine-like murmur in an infant? A. Atrial septal defect. B. Patent ductus arteriosus. C. Ventricular septal defect. D. Aortic stenosis. Correct answer B. Patent ductus arteriosus. Patent ductus arteriosus. PDA typically causes a continuous machine-like murmur. It sounds like this. It results from persistent connection between the aorta and pulmonary artery after birth. It is common in premature infants. Many cases close spontaneously, but some need medication or surgery. Which reflex causes a baby to turn its head when the cheek is stroked? A. Moro reflex. B. Rooting reflex. C. Babinski reflex. D. Tonic neck reflex. Correct answer B. Rooting reflex. The rooting reflex helps newborns find the breast or bottle for feeding. When the cheek is stroked, the baby turns its head toward the touch and opens its mouth. This reflex ensures the infant can latch for nourishment. It typically fades by 3 to 4 months as voluntary head control develops. The absence of this reflex may indicate neurological issues if missing at birth. Which food is avoided until age 1 due to botulism risk? A. Cow's milk. B. Honey. C. Eggs. D. Peanuts. Correct answer B. Honey. Honey can contain Clostridium botulinum spores. Infants under 1 year lack mature gut bacteria to prevent these spores from growing and producing toxins. Botulism causes muscle weakness, poor feeding and breathing difficulties, which is rare but serious. Instead of honey, one can use maple syrup or fruit purees for sweetness. Which parasite causes itchy bottoms in children? A. Tapeworm. B. Pinworm. C. Roundworm. D. Hookworm. Correct answer B. Pinworm. Pinworms are also called Enterobius vermicularis. They are tiny white worms that infect the intestines. At night, female pinworms migrate to the anal area to lay eggs, causing intense itching. Children often scratch the area, transferring eggs to hands and surfaces, which spreads the infection. Diagnosis is confirmed by the Scotch tape test, that is, collecting eggs from the anal skin. Treatment involves oral antiparasitic medication. Example, mebendazole for children and household contacts. Transmission is by fecal-oral route, which is common in daycare or schools. Symptoms are nocturnal anal itching, irritability, disturbed sleep. Prevention is by hand washing, trimming nails, washing bedding. Which vitamin is routinely given to newborns? A. Vitamin C. B. Vitamin D. C. Vitamin K. D. Vitamin E. Correct answer C. Vitamin K. Newborns receive vitamin K injection shortly after birth to prevent vitamin K deficiency bleeding, VKDB. Babies have very little vitamin K, which is essential for blood clotting. Even with breastfeeding, vitamin K levels remain insufficient. Without it, newborns can develop life-threatening bleeding in the brain or intestines. The injection is given universally, typically in the thigh muscle. It is given within 6 hours of birth. The dose is safe and crucial for prevention. Oral vitamin K is less effective and not standard. Which vaccine is given at birth in most countries? A. MMR, B. Hepatitis B, C. Polio, D. DTAP. Correct answer B. Hepatitis B. Hepatitis B vaccine is routinely administered shortly after birth in most countries. This is because newborns are vulnerable to hepatitis B virus transmission during childbirth or from infected caregivers. Early vaccination reduces the risk of lifelong liver disease, including cirrhosis or liver cancer. The World Health Organization and CDC advise the first dose within 24 hours of birth for maximum effectiveness. The vaccine has been used for decades with minimal side effects. Neonates have immature immune systems, making early vaccination critical. Which test confirms Hertzsprung disease? A. Abdominal ultrasound, B. Rectal biopsy, C. Barium enema, D. Stool culture. Correct answer B. Rectal biopsy. Rectal biopsy shows absent ganglion cells in the submucosal plexus. This confirms the diagnosis of Hertzsprung disease. Barium enema may suggest but cannot confirm the diagnosis. Surgical resection is the definitive treatment. What is the most common cause of hypothyroidism in children? A. Hashimoto's thyroiditis, B. Iodine deficiency, C. Congenital hypothyroidism, D. Thyroid dysgenesis. Correct answer A. Hashimoto's thyroiditis. Hashimoto's causes 90% of acquired pediatric hypothyroidism. Anti-TPO antibodies confirm autoimmune origin. Growth delay and declining school performance are common presentations. Levothyroxine dosing is weight-based. Annual thyroid stimulating hormone monitoring is required. What is the most common benign cardiac murmur in children? A. Still's murmur, B. Pulmonary stenosis, C. ASD murmur, D. PDA murmur. Correct answer A. Still's murmur. Still's murmur sounds like this. Still's murmur is a vibratory systolic murmur at the left lower sternal border. It's caused by normal ventricular ejection flow. Intensity decreases with sitting or standing. No diagnostic testing is needed if features are classic. It resolves by adolescence. A 2-year-old child presents with chronic diarrhea, abdominal bloating, and failure to thrive. Symptoms improve after switching to a lactose-free diet. What is the most likely diagnosis? A. Celiac disease, B. Lactose intolerance, C. Irritable bowel syndrome, IBS, D. Cow's milk protein allergy. Correct answer B. Lactose intolerance. Lactose intolerance occurs due to a deficiency in lactase. Lactase is the enzyme that breaks down lactose, the sugar found in milk and dairy products. Without enough lactase, lactose remains undigested in the gut. This leads to symptoms like diarrhea, bloating, gas, and abdominal pain. These symptoms typically appear after consuming dairy products. In this case, the child's symptoms improved after removing lactose from the diet. This strongly supports the diagnosis of lactose intolerance. It is important to differentiate this from cow's milk protein allergy, which involves an immune response to milk proteins, not lactose. A 14-year-old boy presents with sudden onset of severe scrotal pain, nausea, and vomiting. On examination, the affected testis is tender, high riding, and has a horizontal lie. What is the most likely diagnosis? A. Epididymitis. B. Testicular torsion. C. Inguinal hernia. D. Hydrocele. Correct answer B. Testicular torsion. Testicular torsion is a urologic emergency. It occurs when the spermatic cord twists, cutting off blood supply to the testis. Symptoms include sudden severe scrotal pain, nausea, and vomiting. On examination, the affected testis is tender, high riding, and may have a horizontal lie. Immediate surgical intervention is required to save the testis. Epididymitis, inguinal hernia, and hydrocele do not present with such acute symptoms or findings. A 3-year-old child presents with recurrent febrile urinary tract infections, UTIs. A voiding cystourethrogram, VCUG, reveals backward flow of urine from the bladder to the ureters. What is the most likely diagnosis? A. Vesicoureteral reflex, VUR. B. Posterior urethral walls. C. Neurogenic bladder. D. Urolithiasis. Correct answer A. Vesicoureteral reflex, VUR. VUR occurs when urine flows backward from the bladder to the ureters and kidneys, often due to a defective valve mechanism. It primarily affects young children and can lead to recurrent urinary tract infections and kidney damage if untreated. Diagnosis is made via a voiding cystourethrogram, which grades severity from 1 to 5, that is mild to severe. Early intervention is key to preserving kidney function. A 7-year-old boy is brought to the clinic by his parents due to concerns about his behavior at school. His teacher reports he frequently interrupts lessons, has difficulty waiting his turn, and often leaves his seat during class. These symptoms have been present for over a year and occur both at school and at home. What is the most likely diagnosis? A. Autism spectrum disorder. B. Attention deficit hyperactivity disorder, ADHD. C. Oppositional defiant disorder. D. Generalized anxiety disorder. Correct answer B. Attention deficit hyperactivity disorder, ADHD. ADHD is a brain difference that makes focus, impulse control, and sitting still more challenging. It's not about being lazy or undisciplined. Your brain might jump between thoughts quickly, make you act without thinking, or give you this restless energy that's hard to ignore. It's like having a powerful engine with sensitive controls. The good news? ADHD comes with strengths too, like creativity and hyperfocus on things you love. Doctors can help with strategies like breaking tasks into smaller steps, therapy to build skills, and sometimes medication that helps your brain shift gears more smoothly. Plenty of successful people, from athletes to business people, have ADHD brains. They just learned to work with their wiring instead of against it. A 5-year-old girl presents with bright red cheeks and a lacy erythematous rash on her extremities. She recently had a mild fever and cold-like symptoms. What is the most likely diagnosis? A. Measles, B. Rubella, C. Parvovirus B19 infection, fifth disease, D. Scarlet fever. Correct answer C. Parvovirus B19 infection, fifth disease. Parvovirus B19 causes fifth disease, a common childhood illness. It starts with mild cold-like symptoms, that is fever, runny nose, followed by the classic slapped cheek rash on the face and a lacy red rash on the body. The rash may come and go for weeks, but isn't usually itchy or painful. Kids are most contagious before the rash appears, and the infection typically clears on its own without treatment. While usually harmless, it can cause complications in pregnant women or people with blood disorders. Good hand washing helps prevent spread. Key points: nicknamed slapped cheek disease for its distinctive rash. Mild illness in most healthy children. No specific treatment needed. Important to recognize in pregnancy. A 4-year-old boy presents with global developmental delay, autistic behaviors, and macroorchidism. His mother reports a family history of intellectual disability in male relatives. Physical examination reveals a long face, large ears, and joint hypermobility. What is the most likely diagnosis? A. Down syndrome, B. Fragile X syndrome, C. Angelman syndrome, D. Prader-Willi syndrome. Correct answer B. Fragile X syndrome. Fragile X syndrome is a genetic condition that causes learning difficulties and behavioral challenges. Boys are usually more affected than girls. Kids with Fragile X syndrome often have trouble with speech and learning new things, anxiety in social situations, unique physical features like a long face and big ears, hyperactive behavior, or trouble paying attention. It is caused by a problem in a specific gene, that is FMR1. This specific gene is important for brain development. While there's no cure, early help with therapy like speech and behavior support can make a big difference. Many kids with Fragile X syndrome are very friendly and loving once they feel comfortable. Key facts: runs in families, inherited condition, more common in boys. Special tests are needed to diagnose this disease. Help includes therapies, not medicines. A 3-year-old child presents with a 2-day history of bloody diarrhea, abdominal pain, and pallor. Laboratory tests show hemolytic anemia and thrombocytopenia. What is the most likely diagnosis? A. Hemolytic uremic syndrome, HUS. B. Idiopathic thrombocytopenic purpura, ITP. C. Henoch-Schönlein purpura, HSP. D. Leukemia. Correct answer A. Hemolytic uremic syndrome, HUS. Hemolytic uremic syndrome is also known as typical HUS when associated with E. coli O157H7. It is characterized by the triad of hemolytic anemia, thrombocytopenia, and acute kidney injury. It often follows a diarrheal illness. Treatment is supportive with dialysis in severe cases. A 6-month-old infant presents with a bulging fontanelle, fever, and irritability. What is the most likely diagnosis? A. Viral meningitis. B. Bacterial meningitis. C. Hydrocephalus. D. Subdural hematoma. Correct answer B. Bacterial meningitis. Bacterial meningitis is also known as acute bacterial meningitis. In infants, it presents with fever, irritability, and a bulging fontanelle due to increased intracranial pressure. Common pathogens include Streptococcus pneumoniae and Neisseria meningitidis. It is a medical emergency requiring prompt antibiotic treatment. A 9-month-old infant presents with sudden episodes of crying, drawing legs towards the abdomen, and vomiting. On examination, a sausage-shaped mass is palpable in the right upper quadrant. What is the most likely diagnosis? A. Gastroenteritis. B. Intussusception. C. Appendicitis. D. Gastroesophageal reflux disease. GERD. Correct answer B. Intussusception. Intussusception occurs when a portion of the intestine telescopes into an adjacent segment, causing obstruction. Classical signs include sudden onset colicky abdominal pain, crying with leg drawing, vomiting, and a palpable sausage-shaped mass. Currant jelly stools may also develop. Ultrasound confirms diagnosis and treatment often involves air or fluid enema reduction. A 4-week-old infant presents with projectile vomiting after feeds. On examination, an olive-shaped mass is palpated in the epigastrium. What is the most likely diagnosis? A. Gastroesophageal reflux disease GERD. B. Pyloric stenosis. C. Intussusception. D. Hirschsprung disease. Correct answer B. Pyloric stenosis. Pyloric stenosis involves thickening of the pyloric muscle. This blocks stomach emptying, causing projectile vomiting. The olive-shaped mass is key. Diagnosed via ultrasound. Pyloric stenosis is treated surgically by pyloromyotomy. A 5-year-old boy presents with progressive muscle weakness, difficulty climbing stairs, and cough hypertrophy. What is the most likely diagnosis? A. Cerebral palsy. B. Duchenne muscular dystrophy. C. Juvenile idiopathic arthritis. D. Myasthenia gravis. Correct answer B. Duchenne muscular dystrophy. Duchenne muscular dystrophy is an X-linked genetic disorder. The short form of this disease is DMD. DMD causes progressive muscle weakness and cough hypertrophy, pseudohypertrophy. Gover's sign, that is using hands to push up from the floor, is common. A 3-year-old child presents with a vesicular rash on the trunk and face, fever and itching. What is the diagnosis? A. Measles. B. Varicella, chickenpox. C. Hand, foot and mouth disease. D. Scabies. Correct answer B. Varicella, chickenpox. Varicella is caused by the varicella zoster virus. It presents with itchy, fluid-filled vesicles on the trunk and face. Fever and malaise are common. The rash appears in crops and crusts over. Treated with supportive care or antivirals in high-risk cases. A newborn presents with prolonged jaundice, poor feeding and hypotonia. Screening tests reveal low T4 and elevated TSH. What is the most likely diagnosis? A. Congenital hypothyroidism. B. Galactosemia. C. Phenylketonuria, PKU. D. Cystic fibrosis. Correct answer A. Congenital hypothyroidism. Congenital hypothyroidism results from deficient thyroid hormone production. Symptoms include prolonged jaundice, poor feeding, and hypotonia. Newborn screening shows low T4 and high TSH. Developmental delays can be prevented in this condition by treating with levothyroxine. A 1-month-old infant presents with failure to pass meconium, abdominal distension, and bilious vomiting. What is the most likely diagnosis? A. Hirschsprung disease. B. Pyloric stenosis. C. Intussusception. D. Necrotizing enterocolitis. Correct answer A. Hirschsprung disease. Hirschsprung disease is caused by absent ganglion cells in the colon. This leads to functional obstruction, delayed meconium passage, and abdominal distension. It is diagnosed with rectal biopsy. A 7-year-old child presents with sudden onset of petechiae and bruising. Laboratory tests reveal thrombocytopenia. What is the most likely diagnosis? A. Leukemia. B. Idiopathic thrombocytopenic purpura ITP. C. Hemolytic uremic syndrome HUS. D. Aplastic anemia. Correct answer B. Idiopathic thrombocytopenic purpura ITP. Idiopathic thrombocytopenic purpura ITP is also known as immune thrombocytopenic purpura. It is an autoimmune disorder where the immune system mistakenly destroys platelets, leading to thrombocytopenia, that is, low platelet count. This results in symptoms like petechiae, that is, small red spots on the skin, bruising, and mucosal bleeding. ITP often follows a viral infection and is more common in children. Which of the following is the most common cause of acute diarrhea in children worldwide? A. Rotavirus. B. Escherichia coli. C. Salmonella. D. Giardia lamblia. Correct answer A. Rotavirus. Rotavirus is the most common cause of acute diarrhea in children worldwide. Vaccination has significantly reduced its incidence in many countries. Symptoms include vomiting, watery diarrhea, and dehydration. A 1-year-old child presents with a unilateral red swollen eyelid and fever. What is the most likely diagnosis? A. Orbital cellulitis. B. Preseptal cellulitis. C. Conjunctivitis. D. Dacrocystitis. Correct answer B. Preseptal cellulitis. Preseptal cellulitis is an infection of the eyelid and surrounding tissues anterior to the orbital septum. Orbital cellulitis involves the deeper structures and is more severe. Which of the following is the most common cause of seizures in neonates? A. Hypoxic ischemic encephalopathy. B. Hypoglycemia. C. Meningitis. D. Genetic disorders. Correct answer A. Hypoxic ischemic encephalopathy. Hypoxic ischemic encephalopathy is the most common cause of seizures in neonates, often due to perinatal asphyxia. It results from a lack of oxygen and blood flow to the brain during delivery. A 6-year-old child presents with a sore throat, fever, and a grayish white membrane covering the tonsils. What is the most likely diagnosis? A. Streptococcal pharyngitis. B. Diphtheria, C. Infectious mononucleosis, D. Peritonsillar abscess. Correct answer B. Diphtheria. Diphtheria is caused by Corynebacterium diphtheriae. It is characterized by a grayish-white membrane in the throat. It is rare in vaccinated populations but can cause severe respiratory obstruction and systemic toxicity. A 3-month-old infant presents with a persistent cough, wheezing, and difficulty feeding. Chest X-ray shows hyperinflation. What is the most likely diagnosis? A. Asthma, B. Bronchiolitis, C. Cystic fibrosis, D. Pneumonia. Correct answer B. Bronchiolitis. Bronchiolitis is a common viral infection in infants often caused by respiratory syncytial virus (RSV). It leads to inflammation of the small airways, bronchioles, causing wheezing, cough, and hyperinflation on chest X-ray. Symptoms typically peak around 3 to 5 days and resolve with supportive care. Which of the following is the most common cause of viral pneumonia in infants? A. Respiratory syncytial virus (RSV), B. Influenza virus, C. Parainfluenza virus, D. Adenovirus. Correct answer A. Respiratory syncytial virus (RSV). Respiratory syncytial virus is the most common cause of viral pneumonia and bronchiolitis in infants. RSV infections typically peak during the winter months and can cause severe respiratory distress, especially in infants under 6 months of age. Symptoms include cough, wheezing, difficulty breathing, and fever. In severe cases, infants may require hospitalization for oxygen support and mechanical ventilation. RSV is highly contagious and spreads through respiratory droplets. While most cases are mild, premature infants or those with underlying conditions are at higher risk for severe disease. Preventive measures include good hand hygiene and in some cases administration of palivizumab, a monoclonal antibody for high-risk infants. A 10-year-old child presents with polyuria, polydipsia and weight loss. What is the most likely diagnosis? A. Type 1 diabetes mellitus, B. Type 2 diabetes mellitus, C. Diabetes insipidus, D. Cushing syndrome. Correct answer A. Type 1 diabetes mellitus. Type 1 diabetes mellitus is characterized by polyuria, polydipsia, and weight loss due to insulin deficiency. It is the most common form of diabetes in children and requires lifelong insulin therapy. A 2-year-old child presents with a 3-day history of high fever, irritability, and a rash that appears as the fever subsides. What is the most likely diagnosis? A. Measles, B. Roseola, C. Rubella, D. Scarlet fever. Correct answer B. Roseola. Roseola is caused by human herpesvirus 6, HHV6. It is characterized by 3 days of high fever followed by a rash as the fever resolves. The rash is pink, maculopapular, and appears on the trunk before spreading to the extremities. It is a self-limiting condition. A 2-year-old child presents with fever, barking cough, and stridor. What is the most likely diagnosis? A. Asthma, B. Croup, C. Epiglottitis. D. Bronchiolitis. Correct answer B. Croup. Croup or laryngotracheobronchitis is characterized by a barking cough, stridor, and fever. It is caused by viral infections, most commonly parainfluenza virus. The inflammation of the upper airway narrows the trachea, leading to the classic symptoms. Epiglottitis, though similar to croup, is rare due to vaccination against Haemophilus influenza type B. Which of the following is a hallmark feature of Kawasaki disease? A. Erythema marginatum. B. Strawberry tongue. C. Koplik spots. D. Osler nodes. And the correct answer is B. Strawberry tongue. Kawasaki disease is a vasculitis of childhood characterized by fever, conjunctival infection, rash, and a strawberry tongue, that is, red and bumpy appearance of the tongue. It also causes swelling and redness of the hands and feet. If untreated, it can lead to coronary artery aneurysms. Erythema marginatum is seen in rheumatic fever, Koplik spots in measles, and Osler knots in infective endocarditis. A 6-month-old infant presents with failure to thrive, diarrhea, and a history of recurrent infections. Which of the following is the most likely diagnosis? A. Cystic fibrosis. B. Celiac disease. C. Severe combined immunodeficiency SCID. D. Lactose intolerance. Correct answer C. Severe combined immunodeficiency SCID. Severe combined immunodeficiency SCID is a primary immunodeficiency characterized by recurrent infections, failure to thrive, and diarrhea. It results from defects in T cell and B cell function, leaving the infant vulnerable to severe infections. SCID is a medical emergency and requires prompt treatment, often with bone marrow transplantation. Cystic fibrosis and celiac disease can also cause failure to thrive but are less likely to present with recurrent infections. Which of the following is the most common cause of nephrotic syndrome in children? A. Minimal change disease. B. Focal segmental glomerulosclerosis. C. Membranous nephropathy. D. Lupus nephritis. Correct answer A. Minimal change disease. Minimal change disease accounts for about 90% of nephrotic syndrome cases in children. It is characterized by selective proteinuria, mainly albumin, and responds well to corticosteroids. The exact cause is unknown, but it is thought to involve immune dysfunction. Children typically present with edema, hypoalbuminemia, and hyperlipidemia. A 4-year-old child presents with a purpuric rash, abdominal pain, and joint swelling. What is the most likely diagnosis? A. Henoch-Schönlein purpura HSP. B. Idiopathic thrombocytopenic purpura ITP. C. Leukemia. D. Meningococcemia. Correct answer A. Henoch-Schönlein purpura HSP. HSP is a small vessel vasculitis characterized by purpura, non-blanching rash, abdominal pain, and arthritis. It often follows an upper respiratory infection and is caused by IgA immune complex deposition in blood vessels. A 3-year-old child presents with a history of recurrent pneumonia, steatoria, and failure to thrive. What is the most likely diagnosis? A. Cystic fibrosis. B. Asthma. C. Tuberculosis. D. Bronchiolitis. Correct answer A. Cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder characterized by recurrent respiratory infections, pancreatic insufficiency, which leads to steatoria and failure to thrive. It is caused by mutations in the CFTR gene leading to thick mucus production. A sweat chloride test is diagnostic. Which clotting factor is deficient in hemophilia A? A. Factor 8. B. Factor 9. C. Factor 7. D. Factor 10. Correct answer A. Factor 8. Hemophilia A is caused by the deficiency of factor 8, leading to impaired blood clotting. Which of the following is the most common cause of acute glomerulonephritis in children? A. Post-streptococcal glomerulonephritis. B. IgA nephropathy. C. Membranoproliferative glomerulonephritis. D. Lupus nephritis. Correct answer A. Post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis is the most common cause of acute glomerulonephritis in children. It typically occurs 1 to 2 weeks after a streptococcal infection. Example, pharyngitis or impetigo. Symptoms include hematuria, proteinuria, hypertension, and edema. A 5-year-old child presents with fever, sore throat, and a sandpaper-like rash. What is the most likely diagnosis? A. Measles. B. Scarlet fever. C. Rubella. D. Roseola. Correct answer B. Scarlet fever. Scarlet fever is caused by group A streptococcus and is characterized by fever, sore throat, and a sandpaper-like rash. The rash is due to erythrogenic toxins produced by the bacteria. It is treated by antibiotics like penicillin. Which of the following is the most common congenital heart defect? A. Ventricular septal defect VSD. B. Atrial septal defect ASD. C. Tetralogy of Fallot. D. Patent ductus arteriosus PDA. Correct answer Drop your answers in the comment section below. For downloading PDF content and for latest updates, follow our Telegram channel. I have given the link in the description below. If you like this video, don't forget to hit that like button. Thanks for watching.